Mild intellectual disabilities with Amy, Brianne, Charmaine, Jennifer, and Nathan. Mild intellectual disabilities is an impairment of cognitive skills, adaptive life skills, and social skills. Individuals with intellectual disabilities are slower to learn new skills and concepts than their peers, but with the assistance of a supportive educational system, are often able to live independently as adults. Students with intellectual disabilities have general intellectual functioning significantly below the mean, as well as significant limitations in adaptive functioning in at least two of the following skill areas as appropriate to the student's age: communication, self-care, home living, social interpersonal skills, use of community resources, self-direction, functional academic skills, work, leisure, health, and safety. Students can experience intellectual disabilities across a range from mild to profound. A diagnosis of intellectual disability should only be made when a student has significant limitations in both intellectual functioning and adaptive functioning. To be reported to the ministry as having an intellectual disability, the following conditions must be met. So first, the student meets the following eligibility criteria. A student with a mild intellectual disability has intellectual functioning that is two or more standard deviations below the mean on an individually administered Level C assessment instrument of intellectual functioning and has limitations of a similar degree in adaptive functioning in at least two skill areas appropriate to the student's age. So this is a link here listed that has an extensive description of intellectual disabilities.
This module provides a brief summary of what an intellectual disability is. An intellectual disability is a disability characterized by significant limitations in both intellectual functioning and in adaptive behavior, which covers many everyday social and practical skills. This disability originates before the age of 18. The U.S. Census Bureau estimates that approximately 3% or 6.5 million of civilian, non-institutionalized adults had ID in 2010. Intellectual functioning, also called intelligence, refers to general mental capacity, such as learning, reasoning, problem-solving, and so on. It coexists with strengths. One way to measure intellectual functioning is an IQ test. Generally, an IQ test score of around 70 or as high as 75 indicates a limitation in intellectual functioning. Adaptive behavior is the collection of conceptual, social, and practical skills that are learned and performed by people in their everyday lives. Conceptual skills include language and literacy, money, time, and number concepts, and self-direction. Social skills include interpersonal skills, social responsibility, self-esteem, gullibility, naivete, social problem-solving, and the ability to follow rules and obey laws, and to avoid being victimized. Practical skills include activities of daily living or personal care, occupational skills, health care, travel and transportation, schedules and routines, safety, use of money, use of the telephone. Standardized tests can also determine limitations in adaptive behavior. People with intellectual disabilities are your neighbors, co-workers, or fellow students, friends, and family members. Changes in policy over the last decades has meant that the overwhelming majority of people with intellectual disabilities live in the community, on their own, with their families or friends. What is important to them is what is important to everyone, living a healthy and meaningful community life.
Hello, and for this part of the presentation, we're going to talk about epidemiology. So, epidemiology, according to the CDC, or the Center for Disease Control, is a method in which a disease or condition is diagnosed. The prevalence and the risk factors associated with the condition, as well as the causes of the condition. Now, excuse me. Now, epidemiology is not just applied to physical ailments, say like the flu, or a more recent example is the COVID-19 virus, but also can be applied to mental disabilities and diseases, and of course, this is a perfect example for our presentation about mild intellectual disabilities. So, the prevalence of mild intellectual disabilities, or MID, is classified by the DSM-4 and 5 that 85% of the cases of MID are considered mild. So, in other words, the person's IQ is between 50 and 70. From a global standpoint, the over 1% of the population has been diagnosed with MID. Now, some causes and risk factors for MID are numerous, but the most important thing is that most of the causes and risk factors are preventable. So, just some examples here that I've found in research is the most common ones are head injury, and measles, meningitis, whooping cough, exposure to toxic substances. So, an example would be lead or mercury, and also severe malnutrition. Now, all these things that I just listed are risk factors and causes in early childhood. So, maybe between maybe infancy and maybe 3 or 4. And another, as I mentioned before, that MID is preventable if there is self-care during pregnancy. So, issues during pregnancies such as alcohol consumption or drug consumption and malnutrition during pregnancy can severely increase the diagnosis of a child having MID. And also issues after pregnancy, so after the baby is born, the infant is deprived of oxygen after birth, or sometimes if the birth is premature. So, and then, just in summary, that um, in so MID is preventable with, and there is a great reduction of it if there is a lot of self-care during pregnancy, and also the mother takes care of herself, and then these risk factors and causes are greatly reduced. So historically, MID was diagnosed by an IQ test to determine if a child or any individual had an IQ less than 70. And if the person tested less than 70, the psychiatrist or the doctor would diagnose that individual as having an MID. Now, doctors are using more modern methods, along with an IQ test to some degree, to determine this condition. Doctors look for the following to determine if a child or an individual has MID in early childhood. So one is a deficit or lack of in intellectual functioning, so problem solving, judgment, and reasoning, and how this individual uses it in daily life. So maybe, I don't know, walking down the street and seeing maybe how to cross a street, or good judgment of driving is another one. So that's just one. Another one is deficits in adaptive functioning, so social responsibility or socio-cultural standards. So maybe this could also be applied to maybe having mild manners, or maybe even a lack of manners in some degree. And also, thirdly, if MID was procured in early childhood, and at birth. Furthermore, doctors look at other methods of determining MID, along with what I mentioned before. So one is conceptual, so that goes back to language, reading and writing, math, reasoning, knowledge, and memory. Second one is social, so able to show empathy, have good social judgment, communication skills, able to follow rules, so that goes back to both the intellectual functioning and the adaptive functioning I talked about, and make and keep relationships, and not just romantic, but even like maybe friendships. And also the third one is practical. So is the individual able to show independence? Can the person care for himself? Able to do recreation? So like their hobbies. Uh, are they able to do their job well? Can they keep a good memory? And can they organize school and work tasks? So these are just some ways, or these are just the common ways that MID has been diagnosed. So, as I mentioned before, IQ was determined to determine if an individual had MID or mild intellectual disability. But it is still used to some degree, but now doctors and psychiatrists are looking for more practical ways to, and more modern ways to determine if a person has MID, and 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 this is how they are going to diagnose this condition.
It is difficult to measure the prevalence of MID. A reasonable estimate is about 2% of the population. So in a school of 400 students, about 8 students will have MID. People with MID are identified by using IQ scores, behavior tests, or levels of academic achievement. Every individual is unique. Common characteristics of MID literacy and numeracy levels will be lower than the average appropriate expectations. Children with a mild intellectual disability typically have an IQ of 50, 55 to 70. High incidence. Exceptional need occurs often with a greater probability, such as a learning disability. It's often hard to distinguish from students without disabilities, especially in non-school settings, and often displayed a combination of academic, behavioral, and social problems, and can meet the same standards as students without disabilities when highly structured interventions are put into place. Some examples of high incidence disabilities would be communication disorders, such as speech and language impairments, specific learning disabilities, including attention deficit hyperactivity disorder, ADHD, the mild to moderate intellectual disabilities, emotional or behavioral disorders, cognitive impairment, and certain spectrums of autism. Low incidence, a term assigned to a designated or exceptionality that occurs rarely. The disability has a lower probability to occur within the population of students with special needs if compared to the high incidence, such as Down syndrome or deaf and hard of hearing. Low incident disabilities reflect in students that make up 20% of all students with disabilities. Friend and Burzuk say students with low incident disabilities have received some type of special education service since birth, need the same attention as students without disabilities, include students with moderate to severe intellectual disabilities, IQ under 50, may have a developmental delay. Students within special ed have a higher rate at 50%. You have a greater chance of bumping into students with low incident MID. Examples of low incident disabilities would be blindness, low vision, deafness, hard of hearing, deaf blindness, significant developmental delay, complex health issues, serious physical impairment, multiple disability, and certain spectrums of autism. These children may exhibit some of the following characteristics: difficulty with thinking and reasoning. Thinking and processing information and new learning occurs at a slower rate and at a lower level than peers and may have specific difficulties with cognitive processing, require more time than other children, comprehend abstract reasoning and thinking tasks, cause and effect relationships, categorizing, generalizing, and applying what is learned to different situations and contexts. Difficulties with communication and speech and language skills. So receptive and or expressive language, sentences and vocabulary, which are more limited and less complex than peers, use of language, which is often very concrete, understanding and following complex instructions and open-ended questions, finding the confidence and competency needed to speak in front of the class. Learning difficulties with attention and task completion, difficulties with organizational skills, difficulties with self-regulation, social skill difficulties, intellectual disability can coexist with other mental health and medical disorders. Some children with an intellectual disability will have a diagnosis of one or more of the following: ADHD, mood disorders, anxiety, or pervasive developmental disorders such as autism spectrum disorder. The prevalence of a psychological disorder in children and adolescents with an intellectual disability is estimated to be 36%. The prevalence of conduct disorder is about 20%.
Hello, it's Amy here, and I will be doing the assessment strategies for this part of the presentation. First, we will start off with a quote. If a child can't learn the way we teach, maybe we should teach the way they learn. I thought this was important to add in before I started because every child is different and they all learn differently. With the overwhelming amount of assessment tests out there for students, I have found a few that are used to diagnose mild intellectual disabilities. The first one is IQ scores. This is to assess an individual's general cognitive ability. The next one is behavioral tests. It is a method used in the field of psychology to observe, describe, explain, predict, and sometimes correct behavior. The last one is levels of academic achievement. This refers to the level of schooling you have successfully completed and the ability to attain success in your studies. For strategies, you want to examine the errors and why they were made and use this information to direct the next steps in teaching. Give students the opportunity to make a choice in assessment options, allow for retaking of tests or improve their assignments to demonstrate improved learning. Use tracking and documentation of assessment, which is the ongoing gathering of data, to document student progress and the effectiveness of a strategy. Some examples are rubrics, checklists, observations, tests, and self-assessments. Lastly, you want to meet with parents and guardians to discuss concerns and get information. With the overwhelming amount of assessment tests out there for students, I have found a few that are used to diagnose mild intellectual disabilities. The first one is IQ scores. This is to assess an individual's general cognitive ability. The next one is behavioral tests. It is a method used in the field of psychology to observe, describe, explain, predict, and sometimes correct behavior. The last one is levels of academic achievement. This refers to the level of schooling you have successfully completed and the ability to attain success in your studies. For strategies, you want to examine the errors and why they were made and use this information to direct the next steps in teaching. give students the opportunity to make a choice in assessment options, allow for retaking of tests, or improve their assignments to demonstrate improved learning. Use tracking and documentation of assessment, which is the ongoing gathering of data, to document student progress and the effectiveness of a strategy. Some examples are rubrics, checklists, observations, tests, and self-assessments. Lastly, you want to meet with parents and guardians to discuss concerns and get information. How to assess and give feedback. Discuss strategies with other teachers. Choose 1 or 2 behavior goals. Always refer to the student's behavior plan. Provide extra time for tasks. Check understanding frequently. Give immediate and consistent feedback. You can do this by creating a feedback chart or a record of the feedback so the student can always look back. Music has been used for centuries as a healing tool. Music programs showed significant changes in violent and destructive behaviors. Music sparks attention and encourages participation in classrooms. In conclusion, music contributes to the learning experiences of students with mild intellectual disability. Technology is beginning to be very important to our lives and bridges the gap for students with mild intellectual disability. This gives students the opportunity to promote their own self-determination and social participation. It helps students with daily activities, and it also promotes skill building.
Effective interventions. Strategies for teachers. Planning interventions in the classroom. To the right are thinking questions for teachers. These questions go through how you could support a student with a learning disability in your classroom. Looking over to the diagram, students with learning disabilities have average or above average ability, thinking and reasoning. As a teacher, ask, how can I enable this student to show what he or she knows or understands? Demonstrate below average academic achievement. As a teacher, ask, how can I accommodate this student's weak academic skills to ensure access to the curriculum? How can I continue to help the student continue to develop basic academic skills? Demonstrate a significant difference between achievement and ability. As a teacher, ask, how can I make adjustments to instruction and assessment to help the student achieve intended learning outcomes in a way that does not require excessive effort on the part of the student or excessive supports from the adults? Have processing difficulties. As the teacher, ask, how can I reduce the negative impact of the student's processing difficulties in an instructional and assessment context? The next couple of slides will go through some specific interventions that can help support these students within your classroom. Six general classroom tips. Develop language skills. Provide additional reading comprehension strategies and vocabulary instructions to help develop reading and speaking skills. Make math manageable. Many students will have difficulty with advanced reasoning and problem-solving skills. Provide the students with additional strategies for solving problems and questions. Increase their attention spans. Provide prompts and a guidance key to help students know which part of the question/task to focus on. Make up memory mechanisms. Many students have difficulty remembering new information. In daily activities, teach memory strategies such as repeating the information to oneself, remembering information in clusters, and mnemonic devices. Practice and adjust to new scenarios. Teach awareness of transferable material and skills between subject areas. Provide multiple opportunities to develop social skills. All of these general classroom tips I found on a great website that was created by the IXL Learning Company. Giving instructions. Ensure longer tasks are broken down into small steps. Introduce each step separately to not overwhelm the student. State educational objectives clearly and in a concrete manner. Use shorter sentences when explaining tasks in a clear, succinct, straightforward language. Use multiple visual aids, charts, graphs, pictures, PowerPoint slides, etc. Use color to highlight specifics. Record instructions to allow the student to listen to them again. Assignments. Prior to the assignment, provide a reading list and a guidance key. Provide more time to complete assignments. Modify assignments to ensure success for the student. Provide help to form ideas and concepts. Help to organize materials and manage time. Provide more hands-on aids. Seat students near well-minded students who are willing to help them. Promote effort over accuracy where possible. Student-teacher sample interview questions. This interview is set up to further help you as a teacher develop the interventions and support needed in your classroom to help your student. The interview is focused on intermediate students or for students who are in middle school and high school. The purpose of the interview is to better support the student through the learning process. The interview continues on the next slide. Assignments. Prior to the assignment, provide a reading list and a guidance key. Provide more time to complete assignments. Modify assignments to ensure success for the student. Provide help to form ideas and concepts. Help to organize materials and manage time. Provide more hands-on aids. Seat students near well-minded students who are willing to help them. Promote effort over accuracy where possible. Student-teacher sample interview questions. This interview is set up to further help you as a teacher develop the interventions and support needed in your classroom to help your student. The interview is focused on intermediate students or for students who are in middle school and high school. The purpose of the interview is to better support the student through the learning process. The interview continues on the next slide.
Programming gathered from evidence-based research. Family support services are available to assist families with children who have intellectual disabilities, to help promote healthy development, maximize quality of life, and assist families in their role as primary caregivers. Services that are available is respite services. Families can get some rest and relief provided through contracted respite or funding to purchase the respite services that best meet their needs. You can also hire a family member or a close friend as respite service. Support services. These include a range of programs intended to support parents to care for their child or youth with special needs in the home. Some examples of the types of support available are access to a child and youth care worker, behavioral supports, parenting skills training and support groups, counseling, household management services, and life skills activities or programs for children and youth. Families are eligible for family support services with documentation for an intellectual disability. The documentation must be completed by a qualified BC professional, such as a registered psychologist, registered psychological associate, or a certified school psychologist, and reviewed by MCFD's Children and Youth with Special Needs workers. Another program that is available for First Nations children is called Jordan's Principle. Jordan River Anderson was a 5-year-old First Nations child from Norway House Cree Nation in Manitoba. He was born in 1999 with a rare disorder that required hospitalization from birth. After spending the first 2 years of his life in a hospital, doctors felt he could receive care in a medically trained family home near the hospital. However, over the next couple of years, the federal and provincial governments could not resolve who was financially responsible for the necessary at-home care. After spending over 2 years in hospital without cause, while governments disputed who should pay for his at-home care, Jordan died in 2005, having never been able to leave the hospital and receive treatment in a home. On December 12, 2007, the House of Commons supported a motion that affirms Jordan's Principle, named in memory of Jordan. A federal court ruling in 2013 and a Canadian Human Rights Tribunal decision in 2016 means that Jordan's Principle is now law in Canada. To implement Jordan's Principle, the Government of Canada is working to resolve the situation where governments and departments cannot agree about who should pay for services and supports to meet the needs of First Nations child. Cover the cost of public services to ensure sustainable equality, cultural appropriate services, and safeguard the best interest of all First Nations children. Facilitate access to all services and supports for all First Nations children without delay or disruption. What is Jordan's Principle? Jordan's Principle is about ensuring First Nations children receive the services they need when they need them. Jordan's Principle is available to all First Nations children in Canada. It applies to all public services, including services that are beyond the normative standard of care to ensure substantial equality, cultural appropriate services, and to safeguard the best interest of the child. The First Nations Health Authority, FNHA, is responsible for systems navigation of Jordan's Principle resources in British Columbia. This approach, however, does not limit or relieve the federal government of its fiduciary responsibilities to First Nations in BC. Jordan's principle applies in BC. This arrangement does not hinder its definition or implementation. Canucks Autism Network, CAN. The Canucks Autism Network offers programs for children, youth, and adults with autism. The Early Years program ranges from ages 3 to 6 years old. Participants develop fundamental movements and practice social skills while having fun and gaining confidence in a safe and highly supportive environment. The Children's program, ages 7 to 12, participants develop sports-focused movements while practicing to follow group instruction in a fun, safe, and supportive environment. Youth program, ages 13 to 17, programs focused on employment and volunteer experience, physical and mental health, social and life skills, and art and technology. The Canucks Autism Network is also offering virtual youth and adult programs, which the introduction to the world of physical activity and games in real time. A local program that's available is at the Chris Rose Therapy Center for Autism. The school-based program is designed to meet the needs of children between the ages of 5 to 12 years who have been diagnosed as having autism spectrum disorder, ASD. Children attend the center in a place of attending their home school, or they attend the center part-time during the week, with remainder of the week being spent in their home school. The goal for all children is to prepare them for an integrated classroom setting in their neighborhood school. Chris Rose Therapy Center for Autism offers programs such as academics, occupational therapy, speech and language, music therapy, integrated physical programs, and life skills. Chris Rose Therapy Center for Autism also offers parent education for all parents and caregivers who have a child registered in the program. A close liaison is maintained between the child's integrated school placement and Chris Rose Therapy Center for Autism Society. There's also an extended program for ages 6 to 18 years of age. The program is for children aged 6 to 18 who meet the criteria for funding from the Ministry of Child and Family Development through the Autism Funding Program. It provides intensive goal-oriented interventions, services, and an environment outside the child's education program.
To conclude our presentation, we'd like to point out that individuals with mild intellectual disability are slower to learn new skills and concepts than their peers, but with assistance and the proper supports put into place, they're often able to live independently as adults. We'd like to leave you with a list of resources available to help you in your teaching practice. The first resource listed there is a link to a PDF file around supporting students with learning disabilities. This is a guide with documents that include assessment and teaching strategies, intervention and sample planning, documents and supportive tools for teachers, including the student-teacher interview process. There's also the link there to the video that we showed earlier in the presentation. This can be used in the classroom in order to help students learn about what intellectual disabilities are, and it gives a brief summary. The next link there is to access funding supports available, and then there's a link on virtual interactive programs. The next resource page, there's 3 different studies available that can help give you a little more in-depth look at what mild intellectual disabilities are. And you'll also find the Special Education Services, a manual of policies and procedures and guidelines. If you take a look at pages 41 through 46, this focuses on MID. Then you'll also see there's a website that has an extensive description of intellectual disabilities. We also listed a medical journal that provides a brief useful information on alignment in the physical, mental, and emotional and psychological realm of medicine. And then another link there from the American Psychiatric Association, which is an article on what intellectual disability is. And then for the next page, the resources listed would be the Mild Intellectual Disability website there that covers resources for teachers to use to prepare and be acquainted with students who have MID. And then the final resource that we have listed would be a website for teachers to use when teaching students with special needs. This is resourceful because it can act as a cheat sheet on how to teach their students. Thank you for listening to our presentation. Please feel free to pause the video at any point if you'd like to take a look at these resources.